Nicorette Gum can help you quit smoking by replacing the nicotine in cigarettes. Nicotine is an important part of cigarette addiction, and when you stop smoking, your nicotine levels drop quickly, causing withdrawal symptoms such as craving tobacco, nervousness, irritability, headache, weight gain, and difficulty concentrating. Nicotine replacement products like Nicorette Gum are part of a total stop smoking program that includes behavior change, counseling, and support. Stopping smoking is hard, but your chance of success is best when you are ready and have made a commitment to quit. It's important to know that smoking causes lung disease, cancer, and heart disease, so stopping smoking is one of the most important things you can do to improve your health and live longer. As for the daily dosage and optimal timing, it's best to follow the instructions on the packaging or consult a healthcare professional for personalized advice. Before using Nicorette Gum, it is important to carefully read the directions on the product package if it is an over-the-counter product, or the patient information leaflet if prescribed by your doctor. When using the gum, avoid eating or drinking for 15 minutes before and during use, and do not use if the individual wrapper is open or damaged. Start using Nicorette Gum on your quit smoking day. Chew a piece of gum when you feel the urge to smoke, and chew it very slowly until it tingles, then move it to the space between your cheek and gum. Keep it there until the tingling stops, and then begin chewing again. Do not use more than one piece of gum at a time. For the first 6 weeks, use at least 9 pieces each day, and do not chew more than 24 pieces of gum a day. After you have reached the best dose and schedule for you, start to lower your dose after 6 weeks or as directed by your doctor until you no longer need nicotine replacement. It is important to complete the full 12-week treatment with this medication. If you suddenly stop using Nicorette Gum, you may experience withdrawal symptoms such as tobacco cravings, nervousness, irritability, and headache. If this happens, talk to your doctor. And if you are unsuccessful in quitting the first time, don't be discouraged. Many people are successful the next time they try to quit. Some common side effects of Nicorette Gum may include mouth, teeth, or jaw problems, headache, heartburn, sweating, or diarrhea. If any of these side effects persist or worsen, it is important to stop using the medication and consult your doctor or pharmacist. Common nicotine withdrawal symptoms can occur when you stop smoking and may include dizziness, anxiety, depression, or trouble sleeping. It is important to follow the recommended dosage and usage instructions to minimize these symptoms. Chewing the gum too fast can lead to lightheadedness, dizziness, hiccups, nausea, vomiting, or trouble sleeping. If these effects occur, it is recommended to chew the gum more slowly. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the risks of potential side effects. However, serious side effects are more likely if you continue to smoke while using this product. It is important to stop using this medication and seek medical attention if you experience serious side effects such as severe dizziness, mental/mood changes, numbness/tingling in hands/feet, swelling hands/ankles/feet, chest pain, confusion, severe headache, fast/irregular/pounding heartbeat, trouble speaking, weakness on one side of the body, or signs of a serious allergic reaction. This is not a complete list of possible side effects, so it is important to consult your doctor or pharmacist if you notice any other effects. Before using Nicorette Gum, it's important to talk to your doctor or pharmacist if you have any allergies to nicotine or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so be sure to discuss this with your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have any blood vessel disease, dental or jaw problems, diabetes, heart disease, high blood pressure, liver or kidney disease, esophagus problems, stomach or intestinal sores, adrenal problems, overactive thyroid, or if you are planning to have surgery. If you are pregnant, it is best to try to stop smoking without using a nicotine replacement product if possible. However, if you need to use Nicorette Gum during pregnancy, make sure to discuss the risks and benefits with your doctor. It's also important to note that nicotine from smoking and from this medication can pass into breast milk and could have undesirable effects on a nursing infant, so be sure to consult your doctor before breastfeeding. When using Nicorette Gum, it's important to be aware of any potential interactions with other medications you are taking. This is because Nicorette Gum can affect how your body processes certain drugs. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. They can help you understand how Nicorette gum may interact with your other medications and whether any adjustments need to be made. Additionally, when you stop smoking, it can also impact how your liver removes certain drugs from your body. This includes medications such as acetaminophen, caffeine, insulin, oxazepam, pentazocine, propoxyphene, propranolol, theophylline, and tricyclic antidepressants among others. It's important to inform all your healthcare providers that you are quitting smoking so they can monitor and adjust your medication as needed. This is especially important for people who are taking medications for diabetes, high blood pressure, or mental health conditions. Always consult with your doctor before making any changes to your medication. If Nicorette gum is swallowed, it can be harmful and may require medical attention. An overdose of Nicorette gum can cause serious symptoms such as passing out or difficulty breathing. In case of overdose, it is important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include confusion, drooling, seizure, slow or shallow breathing, and hearing problems. If you suspect an overdose, it is important to seek medical attention as soon as possible. This medication is not recommended for use in children under 12 years of age. If you are using Nicorette gum regularly and happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. It's important not to double the dose to make up for the missed one. Stick to your regular dosing schedule to get the best results. When storing Nicorette gum, make sure to keep it at room temperature and away from light and moisture. It's best not to store it in the bathroom. After using a piece of gum, wrap it in a piece of paper and throw it away in the trash, making sure to keep it away from children and pets. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Nicorette gum, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you have any questions about the best way to dispose of Nicorette gum, it's a good idea to consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.